Absolutely. Thank you so much. And I think we are at 4:30 on the dot, so we can get started here. Thank you so much, everybody, for joining us. And thank you, Keystone Progress, for inviting Giffords to be part of this presentation today on the importance of addressing gun violence as a public health issue, and in particular, addressing suicide by firearm. So I'm going to hopefully share my screen successfully. We can make this work. All right. Can somebody audibly tell me if that worked?
Yes.
Wonderful. All right. So I am Polani Cortez-Villas, and I am an engagement manager at Giffords, and I'm really thrilled to be with y'all today. Before we get started, we did want to share some quick resources for the National Suicide Prevention Hotline and the Pennsylvania Crisis Text Line. These resources are always free, confidential, and available 24/7. So we're going to be going into a quick video here.
I'm a gun owner, and we're committed to gun safety. I had postpartum depression after my first daughter was born, and wanted to commit suicide and take my life. And I knew that I had a firearm in my upstairs bedroom, and my husband had hid the magazines from me and the ammunition because he knew something was going on, and that saved my life. I attempted suicide through overdosing on postpartum depression, drugs twice, and survived. We know that suicide is a uniquely lethal issue when a firearm is involved. That having a firearm in your home increases the risk of suicide by 3 times. And that suicide by firearm is 85% lethal. Making sure that your firearm and your ammunition are stored separately could potentially save somebody's life like it saved mine. I'm a responsible gun owner, and that's why I'm committed to gun safety. Join us in the fight for gun safety.
Okay, I'm hearing that there's some bad audio, so hopefully you were able to get the gist of that. Sorry, I'm sorry if there were audio issues there. So some quick framing information before we get started with our conversation. If we're looking at gun deaths in Pennsylvania, nearly 2/3 of them are suicide. And that's about on par with what the proportion of suicides are in the national level when it comes to gun deaths nationwide. And then also half of all suicides in the state of Pennsylvania involve firearms. Between the years of 2013 and 2017, nearly 5,000 Pennsylvanians died by specifically gun-related suicide, which is just a staggering rate. Comes out to about 1 every 9 hours. We know that suicide rates are on the rise, and this is especially true in rural areas, which you can see in the red line there on this graph. And this data just goes through 2018, and we don't have perfect data for the last couple of years, but we know that COVID has had a negative effect when it comes to increasing rates of gun violence and mental health and things like that. And we also know that Pennsylvanian young people are especially at risk when it comes to suicide, and that 10% of youth, and this was data collected in 2017, have attempted suicide. So that is some framing information. As we go into our conversation today, I am thrilled to welcome our fabulous panelists today. We are going to be hearing from John Gold, who is a gun safety instructor and is the president of Gun Owners for Safety Michigan. Claudia Please is a pediatrician and the founder of Bulletproof Kids, which is a safe storage campaign geared towards protecting children from firearms. And she's also a member of Gun Owners for Safety from Utah. Sam Jackson is a doctor based in New York City who is a medical resident in adult psychiatry and is also a member of Doctors for America's Gun Violence Prevention Committee. And then lastly, we are joined by the Pennsylvania native, Carol Asoka, who is a coordinator with Ceasefire PA and is also a member of Gun Owners for Safety Pennsylvania. So I'm just really happy to be here today as part of this conversation, and I'm thrilled to begin this conversation with our wonderful panelists. So I would love if each of our panelists could please quickly go around and briefly introduce yourself and share a little bit more about why this work is important to you and what brings you here today. So Carol, do you mind getting us started?
Sure thing, Polani. Thank you. Hi, everybody. I grew up in Susquehanna County.
had no idea what beefsteaks were because hunting is a tradition and my family never bought beef. We hunted and had venison. So I got a BB gun from Santa Claus when I was 12. And by the 10th grade, I was hunting deer with my dad. My dad gave me my first rifle when I started hunting. And this 30-30 rifle had once belonged to my mom's father, and then it was passed down to my uncle, who then sold it to my dad. Now, in my family, we use our firearms to put meat on the table. Hunting and the guns that we use are part of who we are, and we take pride in what we do and in being self-sufficient, and our firearms are bound up in that pride. Now, I had never really concerned myself much about the dangers of gun violence. It just hadn't been an issue for me, or so I thought. And then a few years ago, a town hall about gun violence piqued my interest. During the Q&A, someone stood up and said, "It's my God-given right to carry an AR-15. Now, while I respect everyone's right to an opinion, I realized that responsible gun owners like myself have a duty to stand up and speak for what's right. So I joined the movement. I raised my voice. I helped to found our new Pennsylvania chapter of Gun Owners for Safety, and I recently became the Southeast coordinator for Ceasefire PA. Now, I know that we're fighting a long battle, but every single life that we can save through stronger mental health services, education, community violence intervention, and stronger gun safety laws makes it all worthwhile. And that's why I am in this fight. Thank you.
Thank you so much, Carol. John?
Hi, my name is John Gold. I am the president of the Giffords Gun Owners for Safety chapter here in Michigan, and a senior ambassador with Giffords. I'm here coming from a completely different tangent than Carol, which is why I love our group. We come from all kinds of different places. I'm a firearms instructor, and I have been for 25 years. And I joined this movement specifically for a lot of reasons, but specifically today because of the reason we're talking about. I have lost 4 people in the last 6 years to firearm suicides. And my fellow members are hearing my story change because it changed last night. It was 3 until last night. It's 4 today. So I'm here today because I'd like a return to sanity. When I was trained and when I came up in this field, the kind of disregard for safety that we see today would have been an anathema. My instructors would be appalled if I had participated in much of the radical activity that we've seen today. So I want to turn around and I want to try to make a difference. And that's why I'm here.
And we're happy to have you, John. Sam, do you want to take it next?
Yeah, both are very inspiring, and I'm sorry to hear that, John. Just want to acknowledge it's inspiring that you're here today. My name is Dr. Jackson. I'm a psychiatrist. I'm a resident physician at SUNY Downstate Health Sciences University. About to be chief, and am a representative of Doctors for America, which is an organization comprising of over 18,000 physician members in all different disciplines and in all different states around the U.S. We advocate for different suicide by firearm prevention initiatives that I'll speak about today, including safe storage and extreme risk protection orders, or both, which are really incredible life-saving tools that communities and physicians have when helping our patients, family members, and community members. In the spirit of feeling inspired by John and Carol, I grew up also in rural northern Michigan, and was in a hunting family and culture where about half of the school on opening day, hunting day, wasn't there. They were in the blinds, enjoying the hunting. And The other thing that happens, though, in northern Michigan and many rural areas is there's very limited access to mental health treatment, and a lot of untreated depression, including one of my close soccer teammates who ended up killing himself using a firearm on the soccer fields that we grew up playing on. As I've gone through my medical training and now completing my psychiatry residency, this issue has only become more apparent on how widespread it is, whether it's in the country, in this inner city in Brooklyn where I'm working, and that these tools, safe storage, extreme risk protection orders, are even more relevant given COVID and how mental health has gotten worse in a lot of communities. So I'm honored to be here with you all. And the last thing is just to thank Paulani for bringing me on, and the organizer of the event. If anything we say matters, it's in large part because of the stage that you've built for us to have this opportunity. So thank you for having me here.
Absolutely. And then Claudia, please.
Hey, thanks. So my story, I'm a pediatrician, retired now from clinical practice since, for about the last 4 years or so. But so the way I really got involved, I did private practice pediatric for 26 years. And then I became the medical director for children with special healthcare needs at the Utah Department of Health. And currently I'm working on a CDC grant, something sort of related and sort of unrelated, which is preventing lead poisoning in Utah. But the way that I actually got involved was Sandy Hook. And I think that's probably a lot of people's stories. So that's what got to me. And, as a parent myself, now with kids in their 30s and grandchildren, and also as a pediatrician, I had not done a good job of asking people about safe storage. It wasn't something I was particularly comfortable with. But after Sandy Hook, I couldn't stop crying, and I felt like I needed to do something. So in our state, which is a very red state, I had to think of something kind of less confrontational. And so what I thought I would work on would be promoting safe storage. So in January of 2013, so the month after Sandy Hook, myself and I found 2 mothers, and we got together and we developed a safe storage campaign called Bulletproof Kids. And so because we needed it to be non-confrontational, we came up with a mission statement to kind of appeal to our culture. And I'll read it to you, which is: owning a gun is a right, protecting children is a responsibility. Prevent youth suicide and accidental injuries. Store your guns safely. So in 2013, we developed a website. We developed videos. We made posters. I had my own patients, my own family guns in the pictures in my house. We made posters and pamphlets and bumper stickers and put up billboards. We obtained cable locks, and I spent a lot of my time actually in the pediatric community educating on the importance of safe storage and giving out locks so that when trying to get the pediatricians to counsel patients, they had something to hand over. So that's how I really got involved. And I continue to be involved in my local Salt Lake City community with other gun violence prevention organizations, and we meet regularly. But I found this organization sort of accidentally, and really am so happy because I feel like nothing much happens in our state, and a lot of things really need to happen at the national level. And I just feel like the gun owners who also believe in safe gun laws is just the perfect fit in the way things are actually going to happen.
Wonderful. Thank you all for sharing a little bit more about yourselves. And we really do appreciate you being here today. And another big thanks to Keystone Progress for hosting us for this summit. So I would love to get started with Carol. Many argue that gun violence is only a problem in large metropolitan areas. And while that is a huge piece of the issue of gun violence, we know that's not the only piece. So as a PA native, what is something that the rest of us need to know about gun violence across Pennsylvania?
Yeah. So gun violence is seen everywhere. In the rural areas, so I grew up in a town with like 200 people maybe in Susquehanna County with nothing to do, right? It was easy. There was a lot of poverty in the town, a lot of poverty in the school district, and very few mental health services. When I was, at the time I didn't know it, but people used to make jokes that we would sit around and watch the mushrooms grow for fun. That's kind of how it was, And when I was a high school sophomore, my classmate, Rich Emmons, we sat next to each other in Spanish. He was quiet, he was nice. He just didn't come to school one day, and come to find out he had shot and killed his father, and then he took his own life. And it was so strange he was there and then he was gone, and nobody knew that he had problems. And then some years later, my cousin, also in a rural area of Pennsylvania, he was 20, he completed suicide with a rifle. He was an only child, clearly struggling. The rifle was unsecured, hid in a closet in the family home. And it deeply impacted the family, deeply. The extended family, the immediate family. And, although I will never know what led my classmate or my cousin into these tragic circumstances, it's clear that they might still be here today if the guns that they had used had been safely stored, not hidden in a closet or stuffed under the couch, but secured in a safe or with a gun lock. So I think that we've heard numbers about the large number of people in rural areas that are completing suicide with a gun. It's a very real problem.
Absolutely. Thank you for sharing that, Carol. Dr. Jackson, can you tell us about your work promoting safe storage of firearms and extreme risk protection orders, and why they are an important piece of this fight to end gun violence?
Yes, thank you. I can and you all can hear me, right? Something changed on my screen. Okay, great.
Yeah, we can hear you.
So to go off of what Carol was saying, part of the DFA, or Doctors for America's gun violence prevention initiative, is through safe storage. There's about 350 million firearms in the US, and about half of them are not stored safely, which is having the firearm locked, unloaded with the ammunition stored separately or locked separately, preferably. What is also an issue is that children in the households where there are firearms not stored safely, majority of them know where they are. And so our group not only wants to be a part of the conversation, destigmatizing the discussion of firearm and safe storage in the doctor's office, but also to advocate for safe storage laws like child access prevention laws that are known to be life-saving tools. There's evidence and studies that show that safe storage is just by counseling and handing out locks. If guns were safely stored, anywhere from 6 to 32% of youth suicides would be prevented, which is extraordinary. Another initiative that we work on is extreme risk protection orders, or ERPOs. Some states have these laws in place which give extraordinary, again, life-saving tools for not just physicians, but community members, family members, where, someone who's experiencing a mental health crisis can temporarily have their gun safely withheld from them in order to prevent them from hurting others or hurting themselves. I have a patient, one among many, but one who's in his 40s. He suffers from schizophrenia and bouts of really severe depression. He's paranoid at times when he doesn't take his medications. And what's difficult is he doesn't really have insight into his illness. so he doesn't take his medications often. There have been times where he's tried to end his own life, times where he's stockpiled weapons, but what he is not able to do to the benefit of his family and himself is access a firearm because of the Herbos laws in place in New York. So I can go to sleep pretty soundly knowing that he's not able to have access to the firearm. What does keep me up at night, however, is that most physicians don't know these laws are in place, that these tools are accessible to them, even in the states that have them on the books. So part of our education campaign for physicians and advocacy campaign is to destigmatize and tell people about how effective they are. One last statistic, but to put it in some context, there's a fancy number called or phrase called the number needed to treat. So an intervention that the number of people that in the community that needs to happen in order for there to be a positive outcome or life saved. Everyone here accepts the fact that we need to get colonoscopies or mammograms in order to save a life for colon cancer or breast cancer. For colonoscopies, the number needed to treat is 450. For mammograms, it's 570. For Herbos, it's 10 to 20. So these are things that we need to have in all states and that people need to know about in order to prevent death by suicide.
Absolutely. Thank you. Those numbers really help to put this in perspective. Oh, go ahead, Carol. Yeah.
Yeah, if I can just add in, Pennsylvania does not have an extreme risk protection order in place. I believe 19 states do. Correct me if I'm wrong. Right now, there is a bill that is being held up in the Pennsylvania legislature for Herbos. And it is one of the things that Ceasefire PA is working to get brought to a vote. And I also wanted to say that Giffords Gun Owners for Safety has signed on to the common agenda in Pennsylvania that Ceasefire is promoting, which includes extreme risk protection orders. So our organization, Gun Owners for Safety, and my organization, Ceasefire PA, are both in support of this, and it just makes sense.
To chime in briefly, if I'd had Herbos and safe storage, my number would be 1, not 4. So I'm telling you that personally, in my story, I would have had a 75% reduction in deaths if I had had effective Herbos in 4 different states or 3 different states to make a difference. So it's a personal statistic. Obviously, it's not a professional ratio, but for me, 3 out of 4.
Absolutely. And John, I was going to turn it over to you next anyway, because I know that you are such a big advocate for Herbos and know that they are such a valuable tool when it comes to saving lives. But how do you explain these types of laws to people who are unfamiliar with them and maybe just don't understand why it's so important that they get on board?
So having come from the other side of the universe, having trained with a lot of groups to the other side of this argument, their fear, whether it's cursory or real, is due process. They're deathly afraid that they will be giving up some kind of right, that we will be infringing, which is the key word that everybody seems to want to use, instead of abridging, which is the word we should be talking about. I think you have to approach people on a practical level. I know that my Giffords teammates have heard me say this 1,000 times, but when we have the conversation, I like to go all the way back to the beginning and say, can we just agree that we'd like less people to get shot? You know, it's not political. It's not adversarial. Can't we just agree that we'd like less people to die? And then can we have that conversation? And I tell my personal story about Herbos, and it's long, so I'm going to abridge, not infringe. My college girlfriend was bipolar. She was served divorce papers by an abusive military husband on base, had himself removed by the police so he wouldn't be there, and left her with loaded firearms and unlocked gun cases, in my opinion, knowing what would happen next. I called the police. She had called me in a wreck, thinking she was going to be a burden on the rest of society. And I told her, no, I was going to come get her and try having that conversation with your wife. I'm on my way to pick up my college girlfriend in LA, and I'll be back as soon as I can be. And we'll work it all out. And the detectives called. I was on my way to the airport. I was the last person to talk to her alive. And had I been able to call the California State Patrol and say, there is a mentally unstable woman with loaded firearms in her house who's a danger to herself and others, Karen might be on this call today. So I take them there and try to give them, I think we have to have stories. I think it's a conversation by conversation thing. I don't think there's a huge platform that we can throw out there to these people and say, hey, you know, this is going to make sense. I think we have to put a face on the issue rather than the other way around. I also think that there's a huge difference between the ERPO debate and the safe storage debate, and we should keep them separate. Because safe storage is a lot more common sense to people than ERPO is. And I think we have a bridge. I think safe storage is really the bridge to get to ERPO in the states where we don't have it, because it's a logical progression. You know, when I grew up being trained on firearms, safe storage was the rule. My instructors told me, if you can't afford the safe, you can't afford the gun. It's different today, and we need it to go back the way it was.
Thank you for sharing that, John. It's definitely very moving and an important piece of why this fight is so crucial to all of us here. And I know it's a big piece of why you're here today. Claudia, as a pediatrician, I'd love for you to speak a little bit about the role that this plays in children, right? So most people don't think of needing to prevent suicide among children, but we saw the graph earlier today, earlier in this session, showing just how prominent that can be amongst children, suicidal ideation. So can you share a little bit about your work as a pediatrician, keeping kids safe from accessing firearms, and why it's a big piece of this conversation today?
Sure. So pediatricians and healthcare people in general played a huge role in counseling families on all kinds of safety measures. You know, we've done it for car seats, we've done it for helmets, we've done it for drowning, poisoning, and infection prevention. We've been a trusted voice, you know, during the pandemic. But the reality is that gun violence epidemic is killing more US kids than COVID has in the last 2 years. So I have a number in 2020, 1,375 kids died from gun violence. And 2021, it's supposed to be even worse. And that doesn't even take into consideration the 3 times as many kids that were injured and didn't die. And now lots of them live with permanent disabilities. So there's also more school shootings in 2021 than any time since 1999. And another thing is, again, this is all kid stuff, is more preschoolers are shot every year than police officers. So again, you know, as a protector, as a physician, trying to keep people healthy and give good information, you know, for the pandemic, I like to compare, we masked our kids, we vaccinated the kids that were able to prevent the transmission, to prevent death and illness. But we haven't done that really for gun violence. And so when firearms now in 2019 surpassed accidents, so motor vehicle collisions, as a #1 cause of death in kids in our nation. And that's just astounding to me. I mean, that outdoes cancer, congenital conditions. It's the #1 cause of death in our kids. But I feel like our counseling practices that we've gotten really good haven't really spread to firearm storage. So 14 million kids live in a home with a firearm, and at least a third, and I think Dr. Jackson said even more, are unsecured. And in Utah itself, like 50% of our homes have firearms, and certainly lots of them are unsecured. What I've really decided, I think is important, is in order, like in states like ours, and it's like medical providers in state like ours, we, #1, must first acknowledge the right to own a firearm without judgment. And then I think we can go somewhere. So if we start with that approach first, we can really feel a little more comfortable about safety counseling. And we can kind of let them know that when household guns aren't stored unloaded and with ammo stored separately, the risk of death and injury doesn't decrease, it increases. So they're less safe. And also that access codes and keys should never, no child should ever have access to a gun. It should never be available to them. So we're approaching it, I feel like almost as if people are going to have guns, and just counseling the same way they're going to have medications in their house or car seats or whatever, and approach it that way. And we may get better buy-in. So the other thing is, so with the motor vehicle crashes, there's successful research, and the public safety and campaigns incorporate responsibility, and it's made motor vehicle collisions go down 66% over the last 20 years. And all of these things need to be replicated to decrease gun injury and death. And then, as mentioned, I think otherwise, that's very important to me, that I feel like counseling alone isn't enough if there's no consequences for bad outcomes. So we really need federal safe gun storage laws, CAP laws, child access prevention laws, because 70% of people support these laws. And so I feel like one state should not be safer for a child than another. And so if it's, again, bottom line is we need to accept that guns exist and they're not going away. We need to educate on safety, and we need to have laws and consequences when negligence happens.
Polani, just to tangent off what Claudia said, it's why Ethan's law is so important. It's why, if everyone doesn't know what HR 748 is, you need to read it, you need to preach it, you need to go out and tell everybody about it. You want your friends to talk about it, you want your mother to talk about it. My family is so sick of hearing about HR 748, they want to run me out of the house. But here's the deal. All it says is that in cases where there are children or people with mental illness in your home, that your weapons have to be secured. Now, my weapons in my house are so secure that you need a key, my handprint, not DNA yet. They haven't made a safe that takes DNA, but to get to a weapon in my home is extremely difficult. It is either on my person or it is locked in a place where it can't be touched. I have friends with mental illness and I have nephews. And if anyone is going to be in my house, my weapons are secured. That's the rule. That's the law in my house. It should be the law everywhere. And it's how I was trained growing up. There's been a metamorphosis, and I don't know when it happened. I do, but it would get highly political. The bottom line is that it's a no-brainer. I had a conversation with a very conservative man who's been my friend for years, who called me actually looking for a headhunter. He was looking for a new job, but he then said, "John, I just saw your posts." And I said, "Yeah. Are you telling me this isn't the law?" He said that to me. "Are you telling me this isn't the law?" And I said, "Well, in a few states it is, but no, nationally, we don't have anything." And he said, "But this is what they taught us growing up. This is a no-brainer. This was their policy." And I said, "Kind of one makes you wonder, doesn't it?" He's joining Giffords tomorrow. So the bottom line is that we need to talk about Ethan's law. Claudia is 1000% right. We need to have a national solution to safe storage and a national standard for safe storage, because once we can start setting standards, we can make this a safer place.
Absolutely. Thank you so much, Sean. I was planning to close out today talking about Ethan's Law and urging everybody to please thank your members of Congress who are already supporting it. Call those who aren't. Right now, we're really close to getting it passed in the House, and then it'll go off over to the Senate. And so a very crucial, simple piece of legislation that would mandate that firearms are safely stored. So no, do not apologize, John. The more we can talk about Ethan's Law, the better. Just getting that stuck in people's brains about how important it is. So absolutely. And something else that Claudia said, talking about it, we did research on motor vehicle safety, and then we understood that people need seatbelts and that we need airbags and things to keep people safe in cars. And there just has not been that same research at the federal level. And so talking about these kinds of federal actions that can and should be taken to keep people safe from gun violence, we need to have research. We need more than $50 million of research for gun violence is a true drop in the bucket when it comes to the federal budget. And we need to be putting more dollars towards this so that we can be just considering how vast this problem is. So absolutely more needs to be done on the federal level. And I'm getting heated talking about it, but I would love to have Dr. Jackson talk a little bit about, you are a psychiatrist and an expert in mental health. And we know that the gun lobby likes to weaponize mental health and say, like, oh, we don't need stronger gun laws. Like, clearly these people just have problems. And, what do you have to say to that, and how it absolutely is something that needs to go hand in hand?
Mm-hmm. Yeah, thank you for the question. I think the language used around mental health and about firearms is extremely important. And the language that they people use, like you said, weaponizing mental health, is deliberate. What they're doing is polarizing people, so that even though initiatives like safe storage, the majority support, using this type of language creates a division in which they can sow some sort of discord. And on the other side, when we're combating this, we need to be conscious of the language that we use. So Dr. Fruin was talking about the way in which we counsel our patients is important. The way that we relate to them and ask them about their firearm and their safe storage is vital for us to be able to build rapport and to build the trust that we cultivate not only throughout our patient encounters, but as a medical establishment, public facing. And the fact is that people with mental illness are much more likely to suffer from gun violence, to be a victim of gun violence, than they are to be the ones perpetrating gun violence. And having access to treatment does not mean that there shouldn't be anything done as far as gun violence prevention initiatives. In fact, having access to treatment, what the evidence shows is that, especially when someone's experiencing a crisis, limiting access to guns is what saves lives. For someone suffering from having thoughts of suicide, time is life. And if you can provide them time and counseling and limit the time that it takes to access a firearm, lives are saved. And so I appreciate the question, because the language is an important thing as we're trying to destigmatize mental health treatment. I appreciate John is extraordinarily inspiring, to be honest, to be here and the way he's talking. The language that everyone on this panel is using goes a really long way to destigmatize not only mental health treatment, but the necessary changes we need to make for firearm prevention.
Really quickly, after what Dr. Jackson just said, I also think we need to learn, it's amazing who brings up mental health as an issue and who slashed the budget for mental health for the last 40 years. I find it highly hypocritical that some sides are using mental health as their out clause on firearms crimes when they are the ones who have prevented insurance companies from being mandated to cover mental health, from the closing of public mental health facilities in states all around the country. it's a very convenient out for them to use mental health to excuse what's happened, and deny the accessibility factor or the effectiveness of the weapon. It's horribly convenient for them and terribly hypocritical.
Absolutely. And thank you all. I think that's going to wrap up my prepared questions, because I do want to make sure that we save time to address some of the questions in the chat. And thank you for everyone who has submitted questions thus far, and please continue to do so, and we'll be sure to address them. But I see a question here that I would actually love Carol to tackle. It's from Nicole Golden, who I know is from Texas Gun Sense, and I, as a native Texan, am just thrilled about the work that they do down in Texas. So she's asking, in states like Texas, in which political will to pass bills like Herbos are absent, what strategies would you suggest state gun violence prevention orgs to prevent firearm suicide?
Polani, I'm sorry, the sound here cut out a little bit. Could you please repeat that question?
Absolutely, I will. But Carol, I just want to say, for you and anybody else, you can also hover over to the Q&A section on your screen, and it should be able, you can read it there, but I will read it again. So in states where there is no political will to take action on gun violence prevention laws, what strategies do you suggest that orgs on the ground, and I think individuals on the ground as well, what can they take to prevent firearm suicide?
That's a great question. I would say coming up with creative ways to provide mental health services for schools, especially, to get involved and provide adequate counseling services for students. Now, we know that the majority of suicides actually, or the population that's most at risk, at least in Pennsylvania, is older men living in rural areas. I would say that educating family members would be particularly effective. And I want to say in Pennsylvania, right now, because there is no extreme risk protection order, but because we are trying to get one on the books and to bring it to a vote, applying pressure to your congresspeople, and also educating people about what an extreme risk protection order actually is and how it works, is the only thing that's going to move us, and having them apply pressure themselves through letters to the editor, calls, visits. Ceasefire PA, if I can plug, is having a advocacy day in Harrisburg on April 26th. We've got a lot of people taking the day off work, students coming from all over the state to have a rally with the governor. And also, we've already scheduled over 50 meetings with representatives and senators for constituents to meet and talk about the common agenda and ask their senators and representatives to support extreme risk protection orders. So, Polani, I'm not sure that really answers the question, but I think it comes down to mental health and safe storage.
Well, you did also mention education there, and I know that you and some other folks on this call, led by our colleague Shannon, who's in the chat posting resources, have been meeting with people and just talking to them about safe storage, meeting with church groups, meeting with environmental clubs, meeting with, a local children's group, just getting the word out and talking about the importance of safe storage, I think, is such an important piece of this. And especially as, many on this call are gun owners, and saying that I am a gun owner and am endorsing this work, and this does not infringe on my right in any way to talk about why it's so important that we store our guns safely. And I feel like that education piece is a big part of that. John, I did see that you unmuted yourself. I don't know if you had something else you wanted to add.
Just that some of the arguments against ERPO is that it's going to be caught up in the legal and due process system, which is already hard to navigate for most people. Right? They're afraid of courts. They don't want to have to deal with the families and the police. I think what we need to do is clearly have clear points of demarcation on the process itself to show people that we're not taking this lightly, that there would be a huge penalty for a false report, that this is not an attempt, again, to infringe on anyone's rights. This is an attempt to be able to save a life. And that's what it has to do. And I will tell you, I come from the Second Amendment side of this argument. And if I someday was found unstable and someone came into my house and took all the firearms out of this house, I would be mad as hell, but I'd be alive to be mad as hell. So, you know what? That's the kind of conversations we have to have with people. It's about saving a life, not taking a right.
Absolutely. So I know many folks here are affiliated with Giffords, but I know, Dr. Jackson, you are with Doctors for America. And so there was a question about, how do we work with different groups to facilitate education on gun violence prevention? And I think that this is a perfect example, right, of folks from Giffords and somebody from Doctors for America coming together. But I don't know if you would like to talk a little bit more about your work, and especially highlighting some of the great partnerships that Doctors for America has in advancing this work. Please share.
Yeah, thank you. I mean, it's extraordinary when Giffords and the inspired former Congresswoman is going around. I think part of it is connecting different groups around the country that are doing this work. Be Smart, Moms for, oh my gosh, I can't believe it. Moms for Safe Firearm Action.
Moms Demand Action.
Demand Action. Some of the partners the DFA have. And one thing that I'm working on in our committee is getting partnerships through different universities. Because this is a physician group, we think it should be a part of physician training. And so medical schools should be teaching all future doctors to be comfortable talking about safe storage, counseling them on firearms, and particularly knowing some of the data and the context in which they're going to practice. This is just the reality of medicine, is that if you're working in the emergency room, you will be helping people who have just either attempted or a suicide by firearm, or who have coming in with gunshot wounds. If you're working in mental health, of course, you'll be working with people with suicidal thoughts. And if you're in the primary care or pediatrics office, then you're a really trusted source that people will go to for information. And so we've been extending our list, hoping to get around all 50 states to be able to include this in medical education.
Definitely, and that's such important work. There is a question about how we work with young people, young gun owners, and young voters, and I will happily address this one. Giffords actually hosts something called the Courage Fellowship, which is a youth leadership development program, and I happen to run it. And we are having our first training for that in a couple of weeks, and we will have 15 fabulous young people from around the country flying to DC, getting advocacy skills and training them on what does it mean to be a young person in this fight to end gun violence. And that is something that I'm really excited that we get to do, and just work with young people who have so much energy and are so excited to be doing this stuff. And then as far as young gun owners, we do have a former Courage Fellow, actually 2 former Courage Fellows who are gun owners as well. So 18 years old, freshman in college, and a gun owner, and have been gun owners all their lives, have done, hunting with family. One of them is a biathlete. So that's how she got into owning a gun, and, have grown up understanding the importance of gun safety, of safe storage, and want to continue sharing that, with others. And so we definitely have lots of work to do when it comes to recruiting maybe atypical gun owners, or gun owners you wouldn't necessarily expect to be part of this fight. But in that same vein, I know, Claudia, we've been working a little bit about maybe getting some more pediatrician gun owners in this work. And I don't know if you'd like to share more about why you think that that's a good piece of this fight. And, I know I'm really excited about it, so please.
Yeah, this was kind of just a new idea, but so as mentioned, I've spent the last 9 years or so working on a safe storage campaign and promoting it. And I feel like it's been successful and docs are talking about it. But I live in Utah, which is like a very high gun ownership state. And I have to mention that there's really, when you go to legislative sessions, there's only one real voice there, and it is, and they're not in favor of passing safe gun laws. So I feel like, so I've been heavily involved in the pediatric community. I'm a past president of our Utah AAP chapter here, which is, I think, 600 or 700 pediatricians. And nationally, we have over like 62,000. So my idea was, there's a lot of people in my state, in my district, the 8th district, who are pediatricians and who own gun owners, but they own guns, but they're not admitting it. They don't want to talk about it. You know what I'm saying? They grew up here. Of course they have guns. They hunt. They do all kinds of stuff with them. They're all about safe storage. They're all about safe gun laws, but they won't admit the fact that they actually own guns and use them. And they probably are very good stewards and, you know, store them safely and all that. But my idea was to try and get them to speak up. So, and become involved in this movement and saying, hey, I'm a doctor, I'm a pediatrician, I'm a safe gun storage. I believe that, you know, the Second Amendment and safe gun laws can coexist. And I'll tell you why. So what we're going to do, I've reached out to my chapter here in Utah, and they said, we'll go for it. So we'll send a notification out and try and get pediatricians to join. And then I contacted our national 62,000 pediatricians and all of the chapters that belong there. And I think we'll formulate a letter that will go out to all the executive directors asking the pediatricians who are gun owners to please speak up, because really what's happened with and this is certainly true, that the safest home is one without a gun. And that's been the standard American Academy of Pediatrics statement for years. And yeah, we all know that's true, but it's also not reality. So we want reality if we want something to happen, and we want legit gun owners, you know, with legit certificates or whatever you want, degrees or whatever, to be the loudest voice in the room, and not these crazy gun groups that seem to be able to get everything passed. We want our voice to be the strongest. I tell the story again because the loudest voice in the room in Utah is the Utah Shooting Sports Council, and they're the ones that show up. So I can show up as a pediatrician, and I always show up and say, hey, I'm a gun owner. You know, I think that'll like soften them a bit. It never does, but I think, hey, I'm a gun owner. I have a concealed carry permit. So I know you're going to pass these safe laws. It never does. But if there's more than just me there, it's going to make a difference. And so that is really the idea I have, is to these silent, embarrassed voices that feel like it has to be one way or the other, have to realize that's not the case and speak up. So anyway, that's the idea.
If I can add on to that, Claudia, such great points. And I think there is a common misconception amongst gun owners that they're the only ones that think that guns should be stored safely and that guns should only be in the hands of people who are going to be responsible with them. And so they're afraid to speak up. Mm-hmm. But what it's going to take to turn things around is for responsible gun owners to speak up and just say, hey, yeah, I believe in safe storage. Yes, I believe in Herbos. We need to take back our country. We need to make it safe for everyone. And we need to become the loudest voices in the room as gun owners who are responsible and who want to save lives.
Yeah, people have been sold on a whole lot of fear. And I think that's something we really don't talk about a lot. One of the arguments that I get when I have a safe storage debate is I won't be able to get to my weapon in time to defend myself. Okay, that's a matter of training. I can open my gun safe, turn and fire in about 1 1.5 seconds. Okay, it's a matter of training. It's a matter of diligence. And a lot of people, quite frankly, are lazy. Now, having said that, I understand the argument, because we have to understand that organizations for years, and I'm not giving them publicity by naming their names today, organizations for years have been selling us on fear. And when you've had fear sold to you since 1972, since a lot of these weapons started coming home from Vietnam, which is when this really started. And it's been I think that we're getting to this now is wonderful, but we should recognize the history. And a lot of people have been getting shot for a long time in certain areas. That said, they've been sold on fear. They've been sold on the 400-pound home invader who's coming in that door. They've been sold on those people committing crime. There has been a campaign for 40 years to these people, and they have been brainwashed with a lot of dogma. So it's going to take it's going to take a diligent long-term effort. And one of the things I used to say before there was a Moms Demand Action, before there was a Giffords organization, I used to say what we need is a full-time organization working just as hard for gun safety and real change as we did having a lobby that promoted, gun sales. So we do now. Mm-hmm. And that's the big first step. We do now. We have a huge bunch of people and a lot of organizations fighting for this. So that's step one. We have to realize that's where we are. We're in step one. And it's going to take a long time and incremental change, but we can do this.
Definitely. I could not think of a better note to end on. So thank you so much, John. And it absolutely is all of us coming together. It's folks from Giffords, Doctors for America, Keystone Progress, amazing, partners working together in this fight, trying to save lives. We're just trying to save lives. And so thank you so much. I want to thank my colleague Shannon. She posted in the chat. If you have any questions, you can reach out to gunowners@giffords.org. Even if you're not a gun owner, Shannon will get that email and she'll send it over to those of us who work on non-gun owner stuff. And so, yes, please check out our website. And absolutely, I know we mentioned earlier about Ethan's Law, but I want to give another plug just for a very simple, straightforward piece of legislation that would mandate that guns are stored safely in the home. Something so simple and easily save many, many lives. So thank you once again to our panelists. Thank you to Keystone Progress for hosting us. And I thought this was a really great presentation, a great conversation rather. And I am just so excited to be in this fight alongside incredible advocates like yourselves who know the importance of this issue and are working every day to just save lives one day at a time. So thank you once again. And I think we'll close it out here, but hope everybody has a great rest of your weekend. Bye.